Another day, another headline screaming about the secret plan to axe hospitals. We all know the NHS needs money and radical reform, and that the people that use it, us, must take responsibility for the health issues that we can prevent. We've tried scaring people into losing weight and taxing alcohol and cigarettes. It's not enough, and it ignores a basic bit of human psychology. If you reward people for good behaviour, they keep doing it. Incentives work for school children, for employees, for customers encouraged to get loyalty cards from shops. The whole gaming sector is built on people's desire to win points, break records and get to the next level. We need to gamify the NHS in the same way. My plan would be to give a health check to the nation, then set people individual health targets. Give up smoking by April, 10 points. Lose a stone in a year, 6 points. Once you reach a set number of points, you get a tax break. It's a rewards-based system. It's simple, and it could help save the NHS.
So, Graeme, I've said many times on this show before, haven't I, how I get so infuriated when people do not take personal responsibility for their own good health. You know, 40% of Brits apparently are going to be obese by 2025. I think that's outrageous. There was a trial, if you like, of this. There was a game last year which was it was gamification, but it was not just technology. It was a physical game in partnership with the NHS and also with Disney, where parents could send off, get these packs, like Disney-related packs and all the rest of it. You got these cards that would give you a physical challenge to do. Every time the kid did the challenge, they got the sticker, you stuck it on this poster. It worked, it got the kids active, and I think when we're looking at statistics such as those obesity ones going through the roof, we have to do something, so I'm with you on that. I think how we'd implement it and what that would actually look like, I'd want to probe you a bit more on that, but in principle, do it.
I think it's a good idea in the sense that I like the idea of incentivising people instead of punishing people. You know, I think that's positive. And I agree that we need to do something about the NHS.
Nick's face is brilliant, by the way. I can't wait to hear what you want.
But, and I know he's going to love this, my only worry is that, in a way, the language of rewarding people is also about punishing people who don't manage to do things. So, for example, if you get a tax break, if you're successful, it means that the people who aren't successful basically end up paying more tax. And I think, you know, and I've made this point before, but I really feel like it's important. Look at the root causes of why people struggle with obesity and health. You know, sedentary lifestyle, low incomes, fast food and additive-riddled food being much cheaper, smoking is often related to stress. The reason why people have these lifestyle problems is often deep-seated, you know, and people who have suffered abuse or have difficult lives often are much more likely to have these problems. So I would be worried about something which rewards people who perhaps actually are the ones who need less help.
But what we do already, we live in a punitive environment where people have to pay more. So the sugar tax, for instance, it basically means, is that going to change people's habits, or is it just going to make people pay more for the habits that they've got? So however we look at it, there are winners and losers, unfortunately. Now, of course, I'm not sort of saying that the people with the most difficult situations shouldn't have all the support that they want, but if we're able to sort of implement a change of culture over a period of time, of course, and Nick's going to say this is a wonderful idea on a piece of paper, but in practice it's never going to work.
It's worse than that.
Oh, it's worse than that, damn. I was going for option B, the soft option. But he really likes me option. But the fact is that there's a huge group of people that do change their lifestyles for the benefit of everyone and for the NHS. So if we can encourage people to do that, then that frees up spaces and opportunities for people that really need it. And I don't think we've got anything to lose. Obviously, you've got to work out the costs, the way you set up people having health checks to measure them. But ultimately, people like rewards.
Nick
gets a biscuit. He gets a biscuit every time he does something at home, don't you? Every time you do a bit of DIY, you get a biscuit. He's doing a lot of DIY at the moment.
Graeme, your arguments are much the way you used to play football.
Average.
Very well-meaning, but ultimately fruitless. I like the idea of tax breaks, right, if you lose weight. Presumably they'll owe me money.
They will, absolutely, yeah.
But don't you realise a lot of the NHS funding is going to lard-ass layabouts who are sitting on their sofa and living on benefits? So how are you possibly going to get to them? It won't make a blind bit of difference to them because they don't even pay any tax because they're too lazy to go to work. And because they're too lazy, they get fat, which means they have to go down to the doctors, which means they have to give them surgery, and then they smoke all the time, and then they get heart disease, and God knows what else. So it won't do anything.
That's a huge
generalisation. The crisis in
generalisation.
obesity is because of basically benefits cheats who sit at home on their sofa.
Not wholly, but there's a fair chunk of it. Yeah, there's a fair chunk. But go to any town centre in Britain, you'll see great lard asses pushing strollers around, strollers around.
Statistics on that, please?
I don't need to see them. I get it. I am out and about with people all day long.
Post-truth,
I'm not going to rise to the bait.
Do you know,
the Ferrari bait. But ultimately, you can't motivate everyone.
If I'm on benefits, I don't give a damn about my tax. I don't even file a tax return.
Well, then you could cut benefits.
But if you were to get cash in hand for signing up to this and achieving something, would that motivate some of those people?
He's going to spend it on more cigarettes or more beer, and he's making himself ill again.
Yeah, but then he goes backwards, or she goes backwards.
Can I ask a question?
Go on.
I love the idea of it, but what about for people who don't really use the NHS and do the right thing, you know, maybe people like us, how often do you go to a doctor or whatever, then what are the incentives for us? Because we're not getting anything.
No, but you could still sign up to the plan. If we take this, you'd obviously have to do pilots and look at the unintended consequences or who misses out.
Yeah.
But if you said this was successful and everybody signed up to it, then of course everybody can benefit. It doesn't necessarily mean that you're going to stop having a healthy lifestyle,
right,
but actually getting rewarded for not being a burden on the NHS, I think we should get rewarded for. Because if you've got a percentage of all of our tax, there's a percentage of that goes to the NHS. Yeah. We don't know what it is because they don't show us. But if we say 20% of the tax that we pay goes to the NHS, but if I can prove over a period of time I'm not taking anything out of that 20%.
Then you should be able to get
why shouldn't people get the opportunity to have some money back?
June is onto something with what she said, because I think that actually this is all based on a bit of a negative view of human nature. I think people want to be fit. You know, people who have healthy lifestyles aren't doing it for reward. They do it because they feel good. And most people who have unhealthy lifestyles, if you talk to them, they don't feel good and they would like to be healthier and they would like some more support to be healthier. So I feel like I'm not against what you're saying, but we haven't exhausted the possibility of actually encouraging and supporting people.
Just eat less and run more.
Yeah, but that's not working, Nick. Everyone knows the health benefits, but it's not working. And it's not just about just presuming that people aren't able to change. They are able to change, but they need the right motivation. I mean, you used to get up at 11 o'clock in the morning, but now you're motivated to get up earlier because you've got a radio show.
14 years I haven't got it. Why do you think the eyes look like this?
Post-truth, Nick, post-truth.
14 years I've been getting up at 5 o'clock in the morning.
Well, I agree with you anyway. And by the way, a reward doesn't just have to be cash. You can do various different things. And my point is, because I'm with you, Nick, personal responsibility, I've said it hundreds of times, but it has to be, when that's not working, you have to try something new. And I'm absolutely in favour of things like gamification and things like that. I think it could work.
Well, I think it's time to try something new.
Yeah.